On behalf of the Northwest Mental Health Technology Center, hello everyone and welcome to today's webinar, Decision Points in Your Agency, What to Consider when Working with Youth Peers. We're thrilled that so many of you can join us to learn more about this important topic. My name is Baird and I work with Portland State University. On behalf of the entire Northwest Mental Health Technology Transfer Center, I'd like to welcome everyone to today's webinar on working with peers and decision points within your agency. Before we begin, I'd like to address a few quick housekeeping items. If you have any technical issues, please submit your questions in the chat box and one of our staff can work with you. If you have any questions during the presentation, please submit these in the Q&A box and we will compile them and review them at the end of the presentation. We are not offering certificates or CEUs for this webinar. We will follow up with you once the recording and any accompanying materials are ready and posted to our website. The MHTTC network is a nationwide network that is supported by the Substance Abuse and Mental Health Services Administration with the purpose of disseminating and implementing evidence-based practices for mental health disorders into the behavioral health workforce. The MHTTC network consists of a national coordinating office, NCO, and 10 regional centers, a tribal affairs center, and a Hispanic and Latino center. Together, our collaborative network supports resource development and dissemination, training and technical assistance, and workforce development to the mental health field throughout the United States. The Northwest MHTTC is based at the University of Washington in the Department of Psychiatry and Behavioral Sciences. We provide training and technical assistance in evidence-based practices to behavioral health and primary care providers and school and social service staff whose work has the potential to improve behavioral health outcomes for individuals with or who are at risk of developing serious mental illness in Region 10, which includes Alaska, Idaho, Oregon, and Washington. Broadly, our goals at the Northwest MHTTC are to heighten awareness, knowledge, and skills of the workforce addressing the needs of individuals with mental illness, accelerate adoption and implementation of mental health-related evidence-based practices across Region 10, and foster alliances among culturally diverse mental health providers, policymakers, family members, and clients. It is our intention to always be mindful of using language that promotes recovery and culturally appropriate terminology. We encourage all clinicians to use and champion person-first language, which emphasizes the individual, not the condition or disability. Person-first language is a way to demonstrate respect for a person's dignity and worth. It is consistent with recovery-oriented practices and promotes treatment environments that foster respect, human dignity, and hope. Before we get started, we'd like to take a moment to introduce ourselves. My name is Baird, and I am a project manager and trainer with the Pathways Research and Training Center at Portland State University. I've worked with many transition-aged youth and young adults as a youth peer support specialist, and I specialize in working with young people in wraparound. I've also been a supervisor for youth peer support specialists in wraparound as well as other mental health settings, and I am a pretty seasoned wraparound and systems of care trainer. As a young person who works with young adults, I also have systems experience with mental health and with the justice system, and I'm pleased to use my lived experience in order to inform the work that I do today. And now I will hand it over to my colleague, Maria.
Hi, everyone. My name is Maria Hermsen-Kritz, and I'm a research assistant with Pathways Research and Training Center at Portland State University. Previously, I was also a peer sports specialist for transition-aged youth and also supervised other youth peer sports specialists in a drop-in center setting. And in my work, I train other youth peer sports specialists and also do communities of practice for them with the MHTTC, and also train other providers who work with young people. And like Caitlin, I also have lived experience in the mental health system and with addiction. And I'm happy to be on this call with you all today. So before we get started, I'll go over our agenda real briefly. And so we will go over our learning objectives, have a couple polls to kind of take the temperature of the room and see where y'all are at with this subject and who we have on the call. Have a little introduction to the subject material and kind of orient us to why this subject matters and why we chose it. Go over some basics questions, basic decision points for your agency in defining the role of a youth peer sports specialist. Go a little bit deeper into some logistical decisions your agency might want to make in hiring and supervision for youth peer sports specialists. Then we have a few common scenarios that we can kind of use to explore some of these questions. We'll open it up to you guys as to anything else that we might have missed, and then we'll open it up to questions before we wrap up. So here are learning objectives for today. After today's webinar, you will be able to understand the importance of settling certain decision points before implementing youth peer services at your agency. Identify which decision points are important to consider in implementing youth peer services, and recognize the various factors to weigh in making these decisions. So we are going to launch a couple polls, and we'll launch them one at a time. And the first one is kind of just to see who is on the poll. So we're going to ask what best describes your role in your agency. And I've launched it now, and you should see it. So I'm going to give everyone like 30 seconds to vote before I end the poll. You guys are voting very fast, and I appreciate that. Okay. So it looks like almost everyone has voted. So I'm going to end polling and share the results. So it looks like we have mostly youth coordinators, though I know not everyone's role might have been summed up by all these options. We have a healthy mix, pretty much split between peers, youth coordinators, program managers, and administrators. So thank you all for sharing. And then the second poll that we wanted to share was to get a better idea of where your agencies are currently at in the process of implementing youth peer services. So we are asking whether you currently have a youth peer program, are starting a youth peer program, have had one for less than a year, or have had a youth peer program for more than a year. So it looks like here we also have a pretty good mix. I'm gonna end that, but if everyone didn't get a chance to vote, that's okay. You can still chat in any other ideas. So it looks like most people on the call don't have a youth peer program, which is great because these are good questions to ask kind of before you start implementing youth peer services. We have 19% who are starting a youth peer program, 7% who have had a youth peer program for under a year, and then about a third of people who have had a youth peer program for more than a year. So that's great. It's good that we have a good mix of experience levels. Thank you all for sharing. Okay, so we are going to start with a little introduction to the content and why we think that this discussion matters for agencies who are considering implementing youth peer services, or maybe who have already started to do so. So for agencies who are implementing youth peer services, and those of you who already have may have encountered some challenges around it, right? Peer support is a relatively new role, so there is not a lot of standardization and clarity around what the role entails, right? It can vary from state to state, it can vary from agency to agency. The standards nationally are kind of loose and the definitions are kind of fluid and changing, right? So when it's implemented, there can be questions around role clarity. What exactly does the role entail? These questions can be from the youth peer support specialists themselves, who might feel unsure about what exactly their own role entails. And they can also be from the colleagues of youth peer support specialists who don't really feel prepared to embrace their new colleagues who are peers. They might not feel like they understand how their own role is shifting, or they might not feel like they really understand the value or importance of peer services. Also, youth peers have very specific needs, right? They're often young professionals who might not have held a professional role before like this. And the youth peer role is kind of a role with an expiration date. So you can't be a youth peer forever necessarily. We expect youth peers to usually be somewhere near the age of the young people they're supporting. So youth peers have kind of specific needs around professional development and support around developing those professional skills. So by kind of determining certain decision points in your agency before implementing youth peer services, hopefully you can head off some certain implementation challenges that we have seen come up with agencies who are implementing youth peer services. So those would be establishing role clarity for both the youth peer staff and their non-peer colleagues. Like I said, existing staff might be wary about youth peer support and how it fits into the existing structures. There can also be issues around stigma and working with young people with lived experience, and a lot of youth peer support specialists have reported that they've experienced stigma from their non-peer colleagues. Research has also shown that youth peer staff are often unclear on what their own role entails and have felt that they have not had enough training going into their role as a youth peer support specialist. It's also important to determine these things in order to prepare youth peer staff for the demands of the role. It can be kind of a trying role in that you're using your own lived experience and expected to kind of revisit some of the more difficult parts of your life, your trauma experiences, right? So in order to kind of prevent the burnout that we say is more of a when than an if with youth peer support, it's important to establish those clear expectations around strategic sharing and vicarious trauma, and then also establish what are the boundaries of the role, what are the expectations with clients and coworkers. By establishing that role definition ahead of time, you can kind of preempt some of that. And I'm going to turn it over to Caitlin now.
Okay, so we're going to talk about first things first, defining the role. So it's really important that when we're thinking about implementing youth peers, we're really actually creating a specific definition of what youth peer means within your agency's context. Because as Maria mentioned, sometimes it changes from agency to agency, especially depending on the population that you might be working with. So some preliminary considerations before you really start getting into the nitty-gritty of your youth peer role. You want to think about how many peers will you hire. In this, you want to think about the population that they will be serving. What is it typically the regular caseload, the number of youth that you serve, what do their demographics look like, and what does youth peer mean within the context of your agency? So for instance, if you work for an agency that serves folks who are mostly in recovery from addiction, then a youth peer would need to be somebody who has had some sort of experience with addiction recovery. Or if you work with an agency that serves young people who are involved in the justice system, you're going to want to have youth peers who have that sort of lived experience. So it's really important that you're getting specific about what youth peer really means. We find that it's also helpful to sort of consider what age range you're looking at hiring, because that will help you really narrow down your search and find folks who I think are very culturally sensitive to young people. So again, we want to consider things like age range. I want to highlight that while youth peers are generally near peers, so close in age with the young people that they work with, they don't necessarily have to be the same age, nor do you need to put a cap on it per se, but you do want to make sure that you're hiring folks who have a good understanding of youth culture and who young people will be able to bond with in some sort of a mutual way. This will allow them to really feel connected with the youth peer and feel like the youth peer's lived experience is relevant to their own. Again, you want to be considering what kind of lived experience is relevant for the population that you serve. So what systems have they been involved in? Is this mental health, residential experience, ACEs, substance use, et cetera? And I would say that that's something that you might want to be specific about within your job description. You want to make sure that any youth peers that you're hiring are relatable. So this is something that involves not just lived experience, but again, a good understanding of youth culture. And I would really encourage you within your agency, as you are making these decisions and sort of looking at these different factors, really ask the young people that you're working with what is going to be important and relevant to them. One thing that we don't want to do is hire somebody who then the youth just think is maybe not that cool, right? So I encourage you to maybe form an advisory council of young people to really help you think about how do we want to define youth peer for our agency and what is best going to serve our population. So once you have that definition hammered out for your agency, you want to make sure that this is all put in the job description. I think it's really good to make sure that there are no secrets. I was always very careful to be clear when we were hiring these peers at our agency to be clear about what lived experience was and what we were looking for. You want to make sure that you're also very clear about specific tasks that are involved in the position. So how will they be providing support? Will this be one-on-one support? Are they going to be leading groups? Are they going to be working in a drop-in center setting? Are they going to be working in a residential treatment setting? Things of this nature. How often will they have to attend team meetings? What does advocacy look like? Perhaps what does their travel look like? I know that when I was a youth here, I spent quite a bit of time on the road. So making sure that you thought about these logistics and that this is really clear in your job description during your hiring process. You also want to think about the qualifications that you're looking for. So youth peer support is a unique role where it's not that there are really any set national or international standards or qualifications outside of lived experience as a young person. So think about what your agency might require. Might you require things like a driver's license, a GED or high school diploma? Do you need them to already be certified, or do you want to already see training or experience in certain areas? I really encourage you to think about this, but also I encourage you to, in order to widen your net, think about how you can be specific about what you're looking for without hindering your recruitment efforts. So again, thinking about whether or not staff need to be certified as peers prior to hiring, or can they be hired and then receive certification, and how will that be paid for? So just to clarify for anybody on the webinar who might not be aware, each state has a different certification process for peer support specialists. Some states have specific certification processes specifically for youth peer support specialists, where they have their own separate training that they are required to take in order to become a youth peer support specialist. Other states just have peer support certification trainings that in each state, in order to be a certified peer support specialist, you have to take this training. These trainings usually come at a cost of a few $100s, and so states and agencies really need to consider if that's something that is in their budget that they would pay for as they are hiring peer support specialists, or if they are only going to accept applications from people who have already received that certification. And I'm going to hand it to Maria to talk about how the peer fits into the existing team structure.
Thank you, Caitlin. So, like I said, it's important to think about how is introducing youth peers into your agency going to affect the roles of existing team members, because their roles might change by adding youth peers to the team. So, for example, colleagues of youth peers might be charged with new responsibilities related to the introduction of youth peer support specialists, such as receiving referrals for youth peer support, perhaps connecting young people to youth peer support specialists, coordinating services with youth peer support specialists, or uplifting youth peer voice at team meetings. One important thing to think about is how are you going to match young people at your agency with youth peer support specialists? I would encourage you to think about how can young people have the biggest say in this process? How can young people's voice be really uplifted in deciding what youth peer they can be matched with? But this is something you'll have to consider. Are youth going to be assigned to a youth peer? And if so, who's going to be responsible for this, and how are they going to make this decision? Is the youth peer going to be involved in this? And does the youth have a say? And then another thing to consider is what is communication going to look like between youth peers and other team members? And that includes caseworkers, therapists, etc. This is something that's important to think about because there can be a lot of role confusion between what exactly is the difference between a support specialist and a caseworker or a clinician. So it's important to kind of hammer that out and define those roles clearly before bringing youth peers on the team, and then really think about what exactly is going to be shared between them and how that's going to be shared. Another important thing to think about is how you're going to ensure this culture shift beforehand when you're implementing youth peer services. So what kind of steps can your agency take to prevent stigma, any kind of resentment towards youth peers by existing colleagues, role overlap? Like I mentioned, there can be some kinds of feelings of overlap between caseworkers and youth peers, and confusion between who's doing what with the young person. How can you work to establish an agency culture that supports youth peer support? So I would encourage you to think about, like, what kind of training can you implement with existing staff, and how can you involve youth peers or people who have training in youth peer support in that process. Another important thing to consider is what are the rules and boundaries that are specific to the youth peer role. So these are big questions that usually agencies decide differently, and there's not really a right answer, but it's important to consider whether texting is allowed and also social media, especially, right now we are in a time when a lot of face-to-face meeting isn't really viable. So a lot of people are texting, but it's important to consider whether you're going to be providing your youth peer support specialists with agency phones, which is usually a good idea if you're going to be allowing them to text with their young people. Similarly, are they going to be having specific agency social media pages, and how are you going to be monitoring these? Also, driving young people can be a big one. Like Caitlin mentioned, youth peers often are driving young people a lot, especially related to wraparound, it seems like. And if so, you know, you have to kind of think about what kind of policies are you going to put in place around driving, around texting, around social media, that kind of thing. Especially with texting and social media and things that are so related to youth culture and peerness and youthiness, it's important to think about how to kind of preserve those boundaries and those ethical boundaries. Also, a good thing to think about when implementing youth peer services is where are the youth peers going to be meeting with the young people? In the agency, in public, at the youth's homes, in system settings, all of the above. These are just good questions to consider when thinking about policies, because these things are going to come up.
Okay, so next we're going to talk about supervision, logistics, and ongoing support. One thing I'd like to highlight about the last slide, though, is a lot of those points that really highlight how the youth peer role looks very different than other traditional roles. And something that I think can be common is that agencies will take the youth peer role and just say, well, we're hiring somebody with lived experience, but they follow the same rules and boundaries and stipulations as our other staff do. But something that's unique about the youth peer role is the youth piece, where we're trying to really meet young people where they're at. And sometimes that means that the communication might look different, right? So I really encourage you to think about those policies that you might have around communication, particularly when it comes to texting and social media, and look into strategies and techniques that other agencies may have used in order to safely implement some of those things within their agencies. And if that's something that you're more curious about, please feel free to reach out to either Maria or myself, and we'll share our contact information after this. Okay, now on to supervision, logistics, and ongoing support. So you want to think about the job classification and structure when you're hiring new youth peers within your agency. So are you going to create a new classification for peers, or is there an already existing role with an analogous classification? Also, something that I've seen is youth peers maybe getting sort of a sub-classification or something of that nature. But thinking about how you're really going to classify and categorize this role, this can also be important for billing purposes if you're solely billing to Medicaid. Also thinking about, are you going to hire full-time or part-time peers? Is this something that's going to be standard across the role, or might it vary from employee to employee? Also, if you are hiring youth peers within different parts of your agency, are there going to be different full-time or part-time roles there? Or are you going to have youth peers, maybe be youth peers part-time as a youth peer and then part-time doing another role? Also, of course, pay considerations are important. We really argue that it's important that youth peers are paid equitably. This is very, very crucial in order for sustainability of the role. Young people already frequently move in and out of jobs and are changing career paths. But when we're working with youth peers and we're working with youth clients, we would really like to at least have that role sustained for a year, right? Studies show that for a young person to have a year with somebody who they feel is a supportive, stable adult can really create impact. So we want to make sure that when we're considering pay and we're considering benefits, what would make somebody stay for at least a year working with their clientele? Something else that is important to consider is, are you going to be hiring in-house or are you going to outsource? So there are peer agencies out there in the world that work specifically as agencies that hire youth peers or peer support. Maria and I, in fact, worked for one of these agencies where we were an entirely peer-run agency, and we would end up having contracts with different mental health organizations or different communities in order to provide peer support. So our agency provided all of the coaching, training, and supervision to the youth peers, and then was paid by counties or communities for those youth peers to work with young people who were in services. However, that means that sometimes there might be something that we were hearing from supervisors that folks within the counties or communities might not necessarily understand nor agree with. So thinking about what are the advantages and disadvantages to doing this. Would you prefer that your agency is the one who is the employer for the youth peer, or would you prefer that they have some sort of support and a youth peer specific agency, and then you can go ahead and contract with that agency? Again, if you're looking for more information on this, I really encourage you to reach out to either Maria or I. Now, supervision. So best practices, or I should say recommended practices, state that youth peers should be supervised by somebody who has experience in youth peer support. Now, what we want to be very understanding about is this is a very new role, and so there are not a lot of folks out there who have experience in youth peer support who also have the necessary experience to be a supervisor. However, if you are an agency who maybe has an established youth peer support program and there's been a staff member there who has done some outstanding work, perhaps they can be a supervisor or a coach for youth peer support that you're hiring in the future. But in the absence of somebody who has experience in youth peer support, how do you handle supervision? Perhaps there is a family or adult peer supervisor who might be able to help provide some coaching, or perhaps the clinical supervisor is the one handling supervision. Now, we want to make sure that if that is the case, that we have some sort of option for the youth peers to still receive coaching. So if you choose not to partner with a peer agency for hiring, they might still be able to partner with you for supervision and for coaching purposes. A common model that we see is shared supervision or split supervision, which is where there's peer supervision by a peer agency and more specific supervision by an in-house supervisor. And then these folks work together to make sure that there is a shared vision for the youth peer support specialist that they are overseeing. So you want to think about how supervision is going to be structured, as well as what kind of training supervisors are going to receive. So as a youth peer support specialist, I know I saw lots of different models for supervision. One of them being that there was group supervision for just youth peer support specialists, and generally with another peer support specialist, where they could get individualized time for things like coaching or any kind of consultation. There's also the one-on-one supervision that youth peer support specialists should be having with their direct supervisors so that they have a good understanding of how they are executing their job and what their expectations are. And then there's also broader group supervision. I know that as a youth peer support specialist for a while, I was receiving clinical supervision with care coordinators and therapists that I was working with on a wraparound team. So you want to think about the different models of supervision and how that's going to work. that within that structure, you also really want to consider how is the youth peer support specialist really getting that peer supervision and that peer coaching piece. Also, you want to make sure that any supervisors of the youth peer support specialists who are not previous youth peer support specialists receive some sort of training and have an understanding of what the role looks like. So thinking about what kind of training supervisors can receive in order to best understand the role and best implement really healthy and sustainable supervision practices.
So another question. Oh, sorry, Caitlin.
No, go ahead, Maria.
Okay, thank you. So another question to consider is what kind of ongoing training and coaching you're going to provide to your peers. Like Caitlin mentioned, your state will probably have a required training for certification of your peers, but usually you might want to provide some kind of ongoing training for them. I know in Oregon, we are required to have, I think, 30 hours of training every 2 years to maintain our certification. So you might want to think about, what kind of training are you going to send your peers to fulfill those hours. So there are different things you can consider. What does your agency value that your peers might want to have as in terms of skills or values? There are different things you can consider. There's suicide intervention trainings, maybe trainings on trauma-informed care, collaborative problem solving, motivational interviewing. I'm sure there's others, but these are just different decision points you can consider and weighing in terms of funding and what's really available in your region. And then we also wanted to open it up to you all, which you can chat into the question box and we'll answer at the end when we get to questions if there's anything we have missed in terms of questions that your agency has considered when implementing youth peer services.
So next we're going to hop into some common scenarios, and we'll have a few reflection questions after each scenario, which if you would like to respond in the comment box, you're more than welcome. But Maria and I will offer some of our reflections after we just sort of present some of these ideas to you. So scenario number 1. A youth peer support specialist is struggling to support a young person who is experiencing suicidal ideation and who has a mental health diagnosis. The youth peer support specialist contacts their peer supervisor, who shares resources with the youth peer, encourages them to normalize and share some of their own experience, and create a safety plan with the youth. With this advice, the youth peer connects with the youth without contacting their clinical supervisor. So some questions to consider. How might your agency respond to this? We know that a lot of agencies are requiring that youth peer support specialists have clinical supervision. And so if this is something that would be required in your agency, what would the expectations be? And then what are some practices or policies that can help strengthen communication? So for instance, is the expectation that the youth peer would connect with the clinical supervisor as well as their peer supervisor? Or would the expectation be that because the youth peer reached out to their peer supervisor and the peer supervisor was able to direct them, that as long as the peer supervisor and or the youth supervisor reached out to the clinical supervisor, that would be accepted? So really thinking about what would the specific expectations and policies around that be so that everybody can maintain good communication with each other. I think also thinking about what does that shared supervision look like? Are there meetings where folks are both together in the shared supervision, or is that happening separately? And when is it appropriate for the youth peer support specialist to contact the clinical supervisor versus their peer supervisor.
Okay, so scenario number 2. You have been tasked with hiring your agency's first peer support specialists. In order to save money, you are only considering applicants who already have your state's peer certification. This has seriously limited your pool of candidates, most of whom do not have lived experience as a young adult in systems. So some questions to consider with this scenario is, what can you do to expand your pool of applicants, and how can you attract more people with relevant lived experience? So I think this is a really common one that comes up when requiring that state certification before the interview, right? The state certification can sometimes be pretty spendy, $300 or $400. So it can be a pretty big barrier, especially to job candidates who are lower income. On the other hand, it can be a big investment for agencies to pay for staff when they don't know if they're going to stick around. So it can be kind of something to weigh either way. So some things to consider might be, thinking about, I know some things that we thought about were doing the training after staff were around for 3 months and just shadowing other staff. That's something that we did at an agency that I used to work for. Considering how to attract people with relevant lived experience, something to do for that would be considering advertising the job in different places than you might advertise some of your other traditional agency jobs like caseworker, clinician. I know at the agency Caitlin and I used to work for, we would advertise on Craigslist, for example, but not just in like the mental health section, sometimes even in like a food service or retail section, because a lot of youth peers who come to the job have not even heard of the opportunity of youth peer support before and don't even know what they don't know. They don't know that it's out there. So that can be one way to attract people with lived experience. But I think when considering the question of having requiring applicants to take the training beforehand or not, you really need to kind of weigh what kind of applicants you're getting and then kind of the cost benefit analysis. Do you have anything to add to that, Caitlin?
No, I think that you covered it really well.
Cool.
So this is our third and final scenario. You currently have one full-time peer support specialist. They are currently at capacity and you have a waiting list of youth. They also only serve a narrow population. Given your resources, you either have the option to keep them on at full-time or reduce them to half-time and hire another half-time peer support specialist. So some questions to consider here are, what is the majority of the population that you are serving? And does your youth peer support staff match these demographics and really able to serve this population? Does your agency have adequate resources for maintaining peer support? And how will you maintain employee retention? Oftentimes, I think because peer support is a new role and sometimes there is some stigma related to such, we see peer support specialists as a little bit more disposable than we may see other staff. And so oftentimes resources aren't necessarily dedicated to expanding the peer support workforce, even though, in my humble opinion, it's the low-hanging fruit for really helping young people engage and be successful in services. So if your agency is only hiring one peer support staff member, I encourage you to really consider if that is serving all of your young people. And then, of course, we want to think about employee retention. Again, youth peer support specialists are generally within their first professional job. And a lot of the time, they're looking for work that is full-time, and they need the work in order to sustain themselves. So if they are working part-time, how are you still helping the job have sort of a career ladder for them? And how are you helping them also create some sort of a team? I think it's also important to consider versus half-time versus full-time on whether or not youth peer support specialists are working with young people in a drop-in center setting, if they're working with youth one-on-one, or if they are working with youth in groups. The reason being is oftentimes one-on-one community-based peer support is spending a lot of time doing things like travel, and part-time might not be the best fit for them. If you're doing something within a drop-in center or a group capacity, part-time might be more of an option. But it's really important to consider how are you going to structure those roles, and how are you going to make sure, again, to retain those employees for at least a year. So now we're going to go ahead and open it up to questions. I'm going to start with the 5 questions that we have in the Q&A box. So the first question that we have is that, in your experience, what is a typical lower limit of age for a youth peer? Someone who will have maturity and perspective to be able to handle the job. Well, I know that in my experience, you have to be at least 18 in order to be certified as a youth peer support specialist in most states. There have been a number of, I would say, 18 to 21-year-olds that I have hired and worked with who have been fantastic. But generally, folks who stay in the job for a long time, I would say, are probably like within their early 20s at least, but that's just anecdotal experience. Maria, do you have anything to add to that?
No, I think it's really, I think 18 is obviously the minimum, and you really just need to evaluate on an individual basis. You can ask good interview questions to gauge perspective and maturity. I don't think you can necessarily tell based on a number alone.
Yeah, absolutely. Our next question in the question and answer box is, would supervisors who are once therapeutic mentors have similar experience? And I assume that this is in relation to similar experience to peers. I would say, while the experience may be similar, because it's not the same, I would still encourage them to get some training on the specific job of a youth peer support specialist, or maybe talk to somebody who has had experience as a youth peer support specialist to get some coaching. I think that therapeutic mentors would definitely have sort of that inherent empathy and maybe sort of understanding of what it's like to work with somebody who has that lived experience. But because the roles are still different, I would encourage them to get some training or some coaching on how to supervise youth peers, which, lucky enough, Maria and I also host communities of practice for youth peer supervisors each month, so you could definitely reach out to us about that. Yeah, Maria, would you have anything to add?
No, I'm actually not familiar exactly with the position of therapeutic mentor, so I think I'll go with you on that one.
Our next question here is, so you talked about how many to hire. Is there a minimum? And how would it go if there's only budget for one? Still okay? This is a great question. So I always think it's good to hire, any hire that you're going to do of a youth peer support specialist is great. So if your budget is for one, that's okay. I encourage you to still go for it. That said, I won't sugarcoat it. It can be pretty isolating as the only youth peer support specialist. So I would really look for opportunities where that youth peer can connect with other people who are within that role. One opportunity that might arise is, again, I'm doing so many shameless plugs here, but the community of practice that Maria and I host once a month for youth peers. But I know that when I was a youth peer myself, that while I worked for a youth peer agency, was in a county where I was the only youth peer for a while. And it can be a little challenging, and there can be some role confusion when that happens. So I would say, yes, please move forward with hiring your youth peer support specialist, but look for opportunities for them to connect with other people who might be in their role. And then our next question, my agency is exploring incorporating youth voice in quality management and improvement processes. Woo! Do you have any input around the ideal number of youth, and how successful have pairings been in your experience? I'm a little confused by the last part of the question. I will say I think that it is great to incorporate youth voice and quality management improvement. And I think that the ideal number of youth around that really depends on the size of your agency. However, I do think it's important that you have more than one young person and perhaps sort of an advisory group of young people in order to provide some feedback, and perhaps young people who are definitely experiencing different parts of your agency and who are either currently receiving or have received services. But when I've seen this happen in agencies that I've worked with, it's been pretty successful. Also, there's a tool out there called the Youth Voice at the Agency Level, the YPSS assessment, that really helps agencies think about how they're incorporating meaningful youth voice, if that's something that your agency would be interested in while they're incorporating youth voice in their quality management process. Our next question says, if a peer specialist is an appropriate fit to be a youth peer support specialist, are there any concerns of having them in a dual role working with youth and adults? Our state does not have a separate YPSS certification. I would just really want to ensure that they understand the differences in the roles, as there are some really key differences between youth peer support and adult peer support. Adult peer support is rightfully very much built in reciprocity and mutuality, whereas youth peer support, not necessarily so. We still have the same principle of mutual respect, but because we are working with minors, that's going to look different, right? There are certain things that we might not share with young people. There are certain boundaries that we are going to have to set and respect. And additionally, when you're working with a young person, they're not the only entity that you're working with. You're working with their families as well. So if you have somebody who is already a peer support specialist, that's an adult peer support specialist looking to work with youth, I would just make sure that maybe they receive some specific kind of training or coaching on what that UCT looks like. Our next question here says that you've said a couple of times that a year of employment to ensure the relationship with youth will last long enough to be helpful. But don't you have to build some more time into the YPSS to really learn the job in order to get the skill to be effective in the first place? How long does it take someone to get trained sufficiently, assuming that they don't come with a training experience? Yes, I would completely agree. I'm just trying to also acknowledge that a lot of the times young people aren't staying in roles for that long, and so we want to make sure that we've got folks who are going to be able to stay for at least a year. I would say it probably takes, well, I feel like I'm still learning, and I was a youth peer support specialist for many years. But it takes at least a week to get the certification training, which should happen within the first 90 days of hire. And then I would say that it probably takes at least 6 months for youth peer support specialists to really find the groove within their role. But I think that that also depends on the person. Maria, I know that you've supervised a number of different people. What do you think about that?
I think, I think it's important to acknowledge, like you said, that not everyone is going to want to stay in the role forever, and that it's an environment of continuous learning, and some people are going to come with more skills than others. But how long does it take someone to get trained sufficiently? I mean, I think after a year, I would say you probably have a pretty good understanding of the role. But like you said, I still feel like I am learning a lot about youth peer support specialists like 5 years after I was first trained. So it's a tough question.
Yeah, it is. I mean, I think that one of the things that peer support is you never really consider yourself an expert, right? Because that's how we maintain sort of that peeriness and youthiness for our young people. But yeah, I would say it takes longer than a year, but a lot of the times it's because of the young population of youth peer support. I don't think that we can expect somebody to stay in the job for 5 years. If they do, fantastic, but that's just not always the reality.
Absolutely.
The next question that we have here is, what measures do you suggest should be in place if your programming is hoping to use social media like Instagram and Facebook? Measures for monitoring safety for peers. So the agency that Maria and I used to work for, what we would do is we would have separate Facebook accounts and Instagram accounts, the ones that were not our personal accounts, where we could communicate with young people. These had to be completely locked down and private, and it had to be very clear that this was our agency account. So for instance, it would say my first name and then the name of our agency. Another thing about it is that the agency administrators would have the passwords and access for our account. So they were able to go in at any time to do things like look at the messages or look at what was being posted. As employees, we were not allowed to post pictures of young people without written permission. We also were not allowed to, mention young people or things of that nature, and our friends list had to be closed down. And what the social media was really helpful for is a lot of the times when young people are in distress, they're posting about it on social media rather than reaching out to people individually. So if we were to see something like that, then we could give the young person a call and have a confidential conversation about what we had seen. So that's a real brief version, but I would say please feel free to reach out to one of us for individual technical assistance about that, because we did find it really useful. We have 2 more minutes, so I want to make sure that I get to as many questions as I can. And I know that we have so many in the chat, and I'm so sorry, everybody. The cutoff age, so one question here, what is the cutoff age for a peer support specialist? There is no official cutoff age, but I would say that for myself, right now, I'm at 31. I probably wouldn't apply to be a youth peer support specialist. Even though I think I still have it going on, I'm sure that some youth would be like, who the heck is this person, right? And there are certain things that I just don't understand anymore. Like, I don't get TikTok. You probably want somebody who gets TikTok. So if you can find a 35-year-old who does TikTok challenges and understands a lot of that youth culture, I would say that they would probably be fine. It's not so much about the age, it's about the youth spirit. And this is how you can find the Mental Health Technology Transfer Center Network. Please feel free to email us at the email that you see here and find out about upcoming trainings, new online trainings, resources, and research updates. Thank you so much to everyone for joining us. I really appreciate everyone who was able to join us today, and I hope that this was valuable for you.
Thank you, everyone. Great questions.